A mom-to-be writes, I have gonorrhea and just read I can pass it to my baby during delivery. What should I do? I'm completely distraught over learning this.
Gonorrhea is a bacterial infection that can be transmitted through genital, oral, or anal sex. It can also be spread from an infected woman to her baby during delivery. The incubation period is usually 2 to 10 days after exposure. If your cervix, vagina, or urethra are involved, your symptoms may include abnormal vaginal discharge, burning or pain during urination, spotting and pain during intercourse. With an anal infection, you might also have discharge, itching, or pain when taking a bowel movement. If you have oral sex with an infected partner, you can develop gonorrhea infection in your throat or mouth, which will become red and sore. If your eyes come in contact with the bacteria by touching infected genitals and then rubbing your eyes, you can develop an eye infection with discharge and itchy red eyes. In order to prevent complications during pregnancy, you should get screened as soon as possible so you can receive proper treatment. This will decrease the chances of complications as a result of gonorrhea, as well as the risk of passing it on to your baby. Gonorrhea can lead to an increased risk of miscarriage and premature birth. In addition, gonorrhea can be passed from mother to a newborn baby during vaginal delivery, which typically leads to a severe eye infection if left untreated. Gonorrhea is very easily treated in an infant, but there's no reason to wait. There are many antibiotics that are both safe for pregnant mothers and infants.